Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
Yep, I'm early today. Well, on time? I don't know. We're at our old time. It's only because Shayna got us up at 5:30. But Hugh needed to be out at the farm by 7, so it all worked out. Sorry, West Coast peeps. Bright and early.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Well, good morning, everyone. Happy Tuesday. It's a gorgeous day here. Yesterday, I did not get a lot of work done on the work that I have to do because we spent 3/4 of the day getting pumpkin from the garden baked and frozen, so we can make pumpkin pies in the fall. Could also use it for the dogs if they get lucky. We froze another 50 pounds of corn, and we froze 15 pounds of blackberries and blueberries that we picked on Sunday. So our freezer is getting very full. Hugh's getting a little annoyed because he can't find the meat that I have now buried with all of my fruits and veggies. So, yes, we ordered another freezer. That'll be 3 plus 2 refrigerators with freezers. Anyway, but I like all this fresh stuff that we're getting. Everything organic and fresh going to be in our freezer for the winter, so it'll be awesome. So last night for the supporters, I did a presentation on urinary tract diseases, and it reminded me about a case that I had 15 or 18 years ago. Oh, you're getting more storms in Northeast Indiana. Doggy's still hanging in there with the CHF, but had to up his Lasix again. Janice asked him if you've got congestive heart failure and you're having to up the Lasix, ask about switching to torsemide. The cardiologists are so scared of switching to torsemide. I've used it on 2 dogs, and let me tell you, it's a game changer. Torsemide is much stronger than Lasix. You use very small doses, but man, it does a good job for those dogs. So when I was talking about supporters, talking to supporters last night about urinary tract diseases, it reminded me of this case that I had many years ago, and it was a little Shih Tzu that the owner brought in. She good client. The dog was middle aged, and the dog had struggled for most of its life with skin allergies. I didn't know near as much as I do now about how to deal with these things, and I don't even know that I had studied Chinese medicine at that point, or if I did, it was very, very early in my acupuncture career. So the dog came in for its annual exam and just had this greasy seborrhea. So if you've ever seen a dog with greasy seborrhea, their coats are very clumpy, and when you touch them, it just feels sticky, greasy, like you just want to go give them a bath. Not only do they have the greasy, clumpy coat, a lot of times they have flaky stuff with it as well, and you're like, how does this occur? Why does this dog have both grease and flakes at the same time? And you give the dog a bath, it looks better for about 5 minutes, and then it instantly goes back to greasy, clumpy. And so we used to use all these drying shampoos on them, and we treat them with steroids and antihistamines, all the usual stuff that before we knew there was something better. And so I had this dog in the back room to draw its blood samples and everything. And at the time, I had an animal communicator who worked in the office with me a lot of days. And he looked at the dog and he got this kind of puzzled look on his face and he said, "What are you doing with this dog?" And I said, "Well, it's just here for its annual, but man, this dog's coat is so terrible and, itchy all the time and it smells bad. These dogs with Greasy Seborrhea smell bad." And he looked at me and he said, "That dog has bladder stones." Now, this communicator had zero medical training, zero veterinary experience, no clue about anything medical. He said, "This dog has bladder stones. I guarantee you this dog has bladder stones. The dog is telling me it's got bladder pain and it's got bladder stones." And I looked at him and I said, "You're kidding me, right?" So I palpated the abdomen. I couldn't feel anything. So I said, "Okay, well, I'll go x-ray this dog. And if I don't find any bladder stones, I'm certainly not charging the client for it. But if I do find bladder stones, then I got to figure out how to tell the client that I x-rayed her dog and that it's got bladder stones." And I was too worried, embarrassed, whatever. I thought she might think I was a nut if I went to her and said, "Hey, I've got this animal communicator back here who says your dog has bladder stones. So I want to x-ray it," because not everybody believes in that stuff. So, yeah, once a dog goes into CHF, they are prone to renal failure, but I've never had it happen with mine. None of my dogs have had kidney problems, even with long-standing heart problems and torsimide. Anyway, so I snuck this dog off to the x-ray room and I took an x-ray, and lo and behold, there's this bladder full of bladder stones. And then I went, well, now I have an issue because for the dog's sake, I certainly can't send it home knowing it has bladder stones and not tell the client. Like, we got to do something about this. So as I struggled with my decision, I finally decided, you know what? I'm just going to tell her the truth and she can think I'm a nut. But, now I've got proof that what the communicator said was true. So I took her dog back in the room and told her the story and said, "You want to see the x-rays?" And she kind of laughed a little bit and looked at me like I was only partly crazy. And so took her back in the x-ray room, showed her the bladder full of bladder stones, and she said, "Well, obviously we have to do something about that." And I said, "Yeah." So we ended up doing surgery on the dog, and I think I ended up changing the dog's diet. And remind you, this is before I had all this information. This is probably 20 years ago. This is before I had all this information about diets and food and everything. So we ended up doing surgery, taking the stones out and treating the dog for its skin problems. So it ended up being a happy ending, and the skin got much better once we got the bladder stones out. But when I was doing my talk last night, it's like those little light bulbs that go off in your head, and I'm like, duh. Greasy seborrhea is a damp heat problem. Bladder stones, damp heat problem. So this dog was eating dry kibble, and this dog, because we had super concentrated urine that made nice bladder stones, and we had this heat being generated in the body from the dry kibble. It was probably a chicken-based kibble. And so knowing what I know now, it's like, well, duh, we need to drain damp from this dog with foods that drain damp. There's a list in that book and that book. We need to decrease heat. So what if we had taken that dog after we got rid of the bladder stones? What if we had taken that dog and put it on a really nice, cooling, homemade diet? A fish, a cod and butternut squash, or a rabbit and even barley if we wanted to use a grain, something that's cooling and draining. And we would have solved both problems. And clearly we still had to get the bladder stones out of there. But the skin would clear up, the greasy seborrhea would go away, the heat would go away, and the dog would feel so much better. So that little dog was sort of the typical. I've seen so many of these, particularly little Shih Tzus, with these problems. in my 35 years of veterinary career, where they come in, they've got this greasy, clumpy coat, they've got dry eyes with mucus production because they've got damp heat there as well. They've got bladder stones, they're itchy, they're smelly, they're miserable, they're painful, they're unhappy, the owners are unhappy. And now I look back on it and say, if I had had this information 15 years earlier in my career, I don't know how much ability we had to get a hold of that much earlier, but I could have helped a lot more animals. So we really have to look at the constitution of what's going on. Do we have heat being generated? Is the animal too cold? Is the animal too hot? Do we have a lot of dampness? Do we have phlegm? Do we have stagnation? And for those of you who are fairly new to this page, this is all traditional Chinese veterinary medicine that I'm talking about. And we talk about things kind of from a different viewpoint, but when you look at it from that viewpoint, it gives you the keys that you need to solve the problems. So looking back on it, I wish that I had, Royal Canin is garbage. I wish that I had the information that I have now. So there's a recipe in that book for bladder damp heat. And it's to help drain that damp heat out of the bladder, help decrease the stone formation. Very, very, very helpful. So we could use that recipe for damp heat of the skin as well. But there are damp heat skin recipes in there too. So, okay, got to get to the farm. We've all kinds of things going on this week. We've got electricians. We're getting a septic system. They're tunneling under the driveway. We're actually making a big ditch across the driveway today. Just all kinds of things going on. So, got to get out there. Yeah, no dry kibble. We need moisture. We need draining. We need cooling. So, okay. Everybody have a wonderful day. I'm going to try to actually get some work done when I get home from the farm, like work for this kind of stuff. Get some blogs written, work on my book. So much going on. Jeanette, I like your statement about animal communicators. Okay, everybody have a great day.